All right, this next topic I think is very poorly understood, and residents, fellows, medical students, nurses, we're all looking at these numbers almost every single day in the ICU setting, and we don't fully understand them. And this is a super important value. It's called the SVV, or the stroke volume variation, okay? And so this is in a patient who has an arterial line, and it is extrapolated, and then we look at the monitor in the ICU and it gives us an SVV. So my number is 13. So if your SVV is greater than 13 or less than 13, what does that mean? Okay, so the stroke volume variability, if it's high, greater than 13, that means we are volume down, okay? We are volume down. If it's greater than 13, that means that we're euvolemic. So our volume is good, okay? So euvolemic, okay. So what is it varying with is the question I always ask everybody, and no one seems to know the answer a lot of times. So stroke volume varies with respirations, okay? And why is that? Well, in a person who's breathing normally, when I take a breath in, when I inspire, my diaphragm contracts, my intercostal muscles contract, and that generates a negative intrathoracic pressure, and air flows into my lungs from the atmosphere. That negative intrathoracic pressure also increases my venous return. So my stroke volume is going to increase in a physiologically normal breathing person when I inspire, and then decrease when I expire, because then I have a positive intrathoracic pressure. So what's the caveat to that? Well, what about in a ventilated patient? Well, a patient on the ventilator is on positive pressure ventilation. So those two parameters are flip-flopped, right? So during inspiration, the ventilator is delivering a breath and causing a positive intrathoracic pressure, which is going to decrease our venous return. Now, again, if varying with respirations are high, the stroke volume variation is high, that means we need to give volume. And another cool way to look at that is looking at IVC collapsibility index. It's the same concept. So your IVC should only collapse like this with respirations, and if you're volume down, your IVC collapsibility index is going to be high.